Hello, this is Dr. Middle. I'm glad to be able to spend some time today as your medical director. I wanted to talk a little bit about flu vaccinations with COVID, and I wanted to talk through why you may or may not be considering taking the flu vaccination. So we know that flu vaccination in the era of COVID is a big deal, and we want to make sure that we understand what's a flu vaccine, why we should get the vaccine, what the challenges, and how we can prevent getting influenza. The bottom line is that we need to be able to protect ourselves, our loved ones, our co-workers, and our residents. First thing to remember about the flu vaccine is that there's no actual virus in the flu vaccine. There are pieces of an inactivated virus that allow your body to develop immunity to the virus. Every year, the influenza virus changes, and that's why we get a flu shot every year. Getting a flu vaccine protects yourself, your loved ones, especially your children, your significant others, your parents, your co-workers, and your residents. And a reminder that it takes about 2 weeks after the vaccination to develop the immunity. So from last season, what we know is that 38 million people had influenza. There were 18 million medical visits as a result of influenza and 405,000 hospitalizations. There were 22,000 deaths that were associated with influenza, and the highest risk individuals are the youngest and the oldest in our population. If you have other chronic medical problems, this also increases your risk of illness and death. So why should we get the influenza vaccine? Since it's made up of viral pieces and not the virus itself, it is considered to be a very safe vaccine. There is no evidence of getting the flu with the vaccine, and there's no evidence linking autism to the vaccination. Symptoms after a flu vaccine might include fatigue, soreness at the injection site, or a low-grade fever. And the only reason to not get a flu vaccine from a medical standpoint is if you have developed anaphylactic reaction to eggs in the past. So we know that with COVID, we have a lot of challenges. We're tired of managing it. We're tired of the testing. We're tired of PPE. We're tired of all of it. But this is also stretching our medical resources, which are already limited and being stretched to the limit. The loss of work due to influenza increases the stress on everyone in healthcare. With the increase in hospitalizations, with ICU use and ER visits related to COVID, there are very limited resources left to treat and manage flu cases. There was a small study from England that has yet to be published that showed that as much as you may have double the risk of death if having both COVID and influenza. And so again, important to recognize that this may actually have a significant impact. Another study from China showed that there is a possibility that having influenza may increase the risk of getting COVID by speeding up the replication in cells. It may also increase the ability of COVID to enter your cells and to start causing infection. Overall, though, experts are unsure of the impact of having both COVID and influenza, although all experts agree that with the risk to similar populations and with medical resources being stretched, that getting a flu vaccine is very, very important. The most vulnerable populations are at risk for both COVID and influenza. We as healthcare team members need to do everything we can to protect the people we serve. If someone has symptoms of COVID, it's also important to remember they may also have influenza, or vice versa. So what can we do? First thing is we need to follow good hand hygiene. We need to keep our hands away from our nose and mouth as much as possible, use appropriate PPE, and isolate if we're sick. It's also super important for us to get a flu vaccination. What can you do to protect yourself and others? Again, good hand hygiene, keeping our hands away from mouth and nose, using appropriate PPE, social distancing, use of masks in public areas, and avoid going to areas where people are gathering. Again, get a flu vaccine. It is so important for everyone around you as well as for yourself. I hope this helps answer some of the questions that you have regarding the use of flu vaccination. I know that there are a lot of people that are concerned about the use of flu vaccinations, but I can tell you that in general, it is safe. I can tell you that your chance of having any kind of significant side effect is very low, and the benefit to both yourself, your loved ones, and those around you is very, very important. I would strongly encourage you to consider taking the flu vaccination, unless you have an anaphylactic reaction to X. If you have any questions, let us know. We're here to help support and encourage and to keep everyone safe. Thank you.